Hello, this is Carol Barnett, and this is my case study. Mr. Tate is a 63-year-old Caucasian businessman who was found down in the road by police, and he was brought to the emergency room of a large university-affiliated hospital. The psychiatry department, was asked to consult for management of a psychotic behavior in the emergency room. Mr. Tate's family reported that the patient had exhibited a 2-week history of strange behavior. Mr. Tate's sister stated that her brother had been running around the kitchen with steak knives, sending paranoid emails about the state of the justice system to his friends. He had been showing the neighbors his guns, seeing people in the walls, not sleeping, and having paranoid thoughts about his wife, who he thought was having an affair. Mr. Tate's wife had reported him missing 3 days prior to his admission to the hospital. His car was found a few blocks away with a large box in the trunk containing numerous medications and the patient's extensive gun collection. Mr. Tate's vital signs were within normal limits. His medical records revealed a history of coronary artery disease and a coronary artery bypass graft 5 years prior to his admission, as well as chronic back pain with several spinal surgeries with an associated history of daily opiate use. He has no prior psychiatric history, including any history of depression or antidepressant medications. His outpatient medications included Lopressor, which is a beta blocker, Flexeril, which is a muscle relaxant, and morphine. His physical examination was notable for heavy sedation. His pupils were dilated, hyperactive bowel sounds, urinary retention, nosebleeds, and depressed reflexes. A CT scan of his head was negative. CT scan of his spine showed degeneration. His blood alcohol screen was negative, and complete blood count and comprehensive metabolic panel results were within normal limits, as were his EKG and his spinal tap. His urine screen was positive for Xanax and Elavil. Mr. Tate's mental status examination revealed waxing and waning alertness, an unkempt appearance, lack of cooperation with nursing and medical staff, somewhat slurred speech, and signs of psychomotor retardation. His affect alternated between subdued and drowsy, and restless and agitated. He denied suicidal or homicidal ideation that focused on his wife's suspected affair. He denied both auditory and visual hallucinations. His judgment and insight were impaired. So as I'm looking at Mr. Tate's situation, there's a lot of medical issues with his history of heart and spinal surgeries, his behaviors with the knives and the guns, and talking to his friends about the justice system. So it seems like there's a lot going on. I'm not really sure, so I would need your help with the diagnosis. Thank you.